Hello students, we'll discuss about an instrument which is mainly used in specialties and tubular structure when you operate, like common bile duct, ureter, vascular system and so on. So what this instrument is, look at that, very lengthy blade, of course finger bows are there, no lock, of course scissors will not have a lock, and here angulated so much. So we can always negotiate the instrument very well. Otherwise, if scissors are like this, if a tube is like this, we won't be able to cut like this. So this is angled, you can cut very well. So this is Pott's scissor, very useful scissor with the length like this, curve, such a curve, deep curve, very important angulated tip. It makes you to cut, go through the like ureter when you want to cut, common billet when you want to cut, or vessels when you want to cut, or any tubular structures when you want to cut. It's very, very useful scissor. It is called a Pott's scissor. It's lengthy. I already told, deep CBD vessels, ureters. This angle helps you to manipulate or maneuver in the deeper plane so that cut properly. Otherwise, traditional curved scissors very difficult to pass into the tube lumen of the ureter or common bile duct, cut properly as you want. Where this facilitated your technique very clear and meticulous. Such that is a Pott's scissor. Students, you can go through my clinical methods in surgery for detailed examination of different surgical aspects, and manual of surgery detail about all topics, UG, CBME syllabus and PG and basics, and operative surgery in detail 2-volume book gives everything about surgical operative skills, methods with the technique and illustrations. And my DigiNow lectures gives a detailed idea of lectures through JP Publishers about all topics for the UG as well as basic for the PGs. So today I hope you understood this Pott's scissor very well. Thank you very much.